Once upon a time. That's a happy story start, right? Mine didn't feel so happy really. It began with angry thoughts, and then sad ones, and confusing ones. Imagine a box filled with negative things, and wherever you go the box is with you. No escape. I guess the saddest thing was that I wasn't the only one. Far from it. Too scared to go to school. Nobody understands me. My parents won't stop arguing. People bully me in school. Did you know that 1 in 10 young people have mental health difficulties? I didn't know it at the time, but I was one of those young people. I felt alone and I stopped hanging out with my friends. I couldn't stop crying and I found it really hard to concentrate at school. My mum noticed how much time I was spending by myself. I didn't think it would help, but she took me to the doctor for advice. The doctor referred me to this service for young people. I asked what that was, and the doctor told me that they were part of a child and adolescent mental health service, and they were there to help children and young people with their problems. When I went for my appointment, everybody was really friendly, and I saw a therapist called Phil, who was trained in something called Cognitive Behavioural Therapy as part of the CYP IAPT programme. When I met with Phil, we talked about my problems. We decided that the best thing to do is meet once a week, so he could help me understand why I'm having these thoughts and help me feel better. I was quite nervous before we started the session, but he really put me at ease, and every week he asked me how I felt and didn't judge me if I told him I wasn't feeling great. He helped me to think differently about my problems, and we did exercises and relaxation techniques to help me cope. One thing we did was brainstorm ideas to help me think about different ways to tackle my problems. Then we decided which of these ideas I wanted to try first. The next time we got together, I told him this hadn't worked so well, so we tried another idea which was much better. As we went through the sessions, Phil kept checking how I was. Because we had written this down, it helped me keep track of how I was feeling, and I could really understand what helped me and what didn't. I had 8 sessions, and afterwards I felt much better. I think it really worked because it was good to talk to someone, and I felt that Phil and I really worked as a team to help me find a solution to my problems. It helped me challenge my negative thoughts, and I realised that I could think more positively. I felt really in control, and I knew if I wanted to change something I could. Because we wrote down how I was feeling, I could understand how I felt and think about what I could do to change that. I know it's a long road and I still get negative thoughts sometimes, but the skills I learnt with Phil still help me. Talking helped me. If you think it could help you too, you can find out more online at www.myapt.org.uk or by checking out your local child and adolescent mental health services. It's okay to ask for help.